BSI scene safe?
It is.
Ma'am, are you already okay? I got nothing. Call 911, get an AD. I'm checking for breathing and pulse simultaneously. No less than 5 seconds. No more than 10. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000.
The patient is unresponsive, apneic, and has a weak pulse of 60.
I'm gonna open the airway, hit tilt, chin lift. What do I see?
The mouth is full of secretions and vomitus.
This time I'm going to, this should have already been attached. I'm gonna turn my oxygen on, make sure it works. It does. I'm going without suction. I'm gonna suction circular motion, no more than 10 seconds.
The mouth and oropharynx are clear.
At this point, I'm gonna measure an OPA. I'm gonna measure from the corner of the mouth to the earlobe. This one looks like it fits. I'm using the cross finger technique. You wanna come over here? Using the cross finger technique. I'm going in upside down, scraping the hard palate, rotating 180 degrees. Does the patient accept the adjunct?
No gag reflex is present and the patient accepts the airway adjunct.
At this time, I'm gonna give my extra point. I'm gonna attach my BVM to my O2. That was already here. 15 liters a minute. I'm gonna start rescue breathing. 1 breath every 5 to 6 seconds. Breathe. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000.
The ventilation is being properly performed without difficulty.
On my own, I'm gonna check for a pulse, no less than 5 seconds to more than 10, 3, 1,000, 4, 1,000, 5, 1,000. We're to assume she still has a pulse. I'm gonna continue rescue breathing. 1 breath every 5 to 6 seconds. Breathe. 1,
How would you know if you are delivering appropriate volumes with each ventilation?
Adequate chest rise and fall.